to gear up for our final discussion of the day. It is going to be a fireside chat, nurse staffing and workload. It is two critical factors that can make or break a patient's safety and nurse morale. So we're deep diving into the trenches to uncover fresh strategies and promise to revolutionize how we approach these challenges. I would like to invite three lovely ladies to the stage. First up, I would like to invite Colonel Madhumita Dal, Dr. Neeta Nagra, as well as Dr. Shruti Mohan. Please put your hands together for these lovely ladies. All right, ladies, the stage is yours.
Hi, everyone. So we'll start off with introductions. I'm Neeta Nagra. I'm a mental health nurse with over 17 years of experience in healthcare. In addition to that, I have a Doctor of Education in Leadership, and I've worked in various leadership roles in healthcare for over a decade. More recently, I've just founded my own leadership consultancy called Fit to Be Strong Leader, and essentially it focuses on empowering individuals to develop leadership competencies, specifically through my framework for self-mastering leadership. And I'll pass it over to Madhumita.
Thank you, Neeta. I'm Colonel Madhumita. I have done my nursing from Armed Forces Medical College, Pune, and I had been into Indian Army for 23 years. I have a total experience of 35 years plus, and currently I'm the nursing director in Rajiv Gandhi Cancer Institute and Research Center, Delhi.
Hello, everybody. I'm Dr. Shruti Mohan. I'm a Chief Quality Officer, Lotan Hospital and Canadian Medical Center. I'm a PhD in Healthcare Management, and my background is engineering. So you'll be wondering how engineering to a healthcare field. It's a wonderful journey. I have graduated from NHQ, Certified Professional in Healthcare Quality, and my entire experience lies in hospital commissioning, operational phase, doing policies and procedures for the hospital. Accreditation is my main strength, where I have worked with Joint Commission International, American standards, Australian standards, along with American and other healthcare standards. So here we are going to start the chat. So as a quality professional, I am here as an unbiased person from the nursing, because nursing is going to talk about workloads. So when they talk about workload as a person, apart from standing away from nursing team, I should be giving you an unbiased opinion. So let me have a question. I would like to ask Colonel Madhumita about what are the effective strategies that we can implement to resolve the challenges and staff nursing issues, workloads. What are the impediments that you face, and how can we resolve these issues?
Thank you, Shruti. Actually, we all know that nurses, they are the frontline workers, and no hospital can work without a nurse. And these nurses, they are always by the patient, at the bedside, 24/7. So obviously, if as a nurse, I'm a nurse. So as a nurse, if you want the patient to have a good quality care, then the nurse's workload has to be understood and the nursing staffing has to be understood. So there are various challenges. Few challenges I would like to quote. Number one is, like hospitals, you have, in hospitals we have multi-dimensional care. No hospital has a specific, until unless it's a super specialized hospital. Mostly all the hospitals have multi-dimensional care, and for that multi-dimensional care, you need specialized nurses. That means if a unit is a nephrology unit, then the nephrologist expects the nurse to have some skill related to nephrology, patient care. So, and it becomes very difficult to have skilled nurses with adequate competency to meet patient safety and patient care. Simultaneously, there are in the hospitals, you do not have fixed number of patients. Sometimes there will be patients, few patients in the wards, and sometimes the patients in ICUs, you may get too many number of patients. On the top of that, if you have a surge of patients coming in, then obviously the workload increases in the staffs and the patient care is compromised. Another challenge what we face is acute shortage of the nurses globally. As per WHO, there is 5.9 million shortage of nurses globally. So you can understand if there is acute shortage of nurses globally, the amount of workload a nurse can have and how the patient care can be compromised. Over to Nita to share your experience.
Thank you. So interestingly enough, you were talking about empowering nurses, and I was actually reading an article where they were talking about in the US, companies spent over $147 billion on training their employees and staff. However, there's very little return in investment. And the reason for that is because people join good organizations, however, they leave poor managers. And so I see this as being an issue in healthcare. I think the biggest issue actually is projection bias. So projection bias is essentially when individuals think that other people think and act or value the same things that they do. And if we look at who is in leadership in healthcare, majority of the individuals are either baby boomers or Generation X. And the reality is the workforce that we have now, which is Generation Y and Generation Z, have very different values. The other thing I'd like to point out is that the staffing models, I guess, staffing models and the way we created workload for nursing has changed. So we're dealing with more acute illnesses. We have more complex issues. As we heard earlier today, there's more toxins, there's more substances which are causing more complexity. There's technology now. In addition to that, the workforce has changed, the people have changed. The values of the people now are that they want to feel empowered. They want to have autonomy. They want to be respected. They want to have work-life balance, and they want to have meaningful work. And yet, we are still using the same old models to manage nurses and also staff nurses. So what we actually need to do is we need to look at what is the underlying cause. The underlying cause is the needs for nurses are not being met. So what we have to do if we really want to resolve these issues, we need to look at what the needs are for the nurses and meet those needs. So we need to change the way we, for example, staffing hours, those need to change. Is it actually safe and healthy for nurses to be working 40 to 44 hours a week? Is it healthy for them to be picking up overtime? There's a lot of different things we actually need to look at to determine if the strategies we actually have in place are effective, and then based off of those, moving forward, changing the way we do things so that we can actually meet the need for nurses. Shruti, I'll pass it to you.
Yeah, the thing is that you were talking about the models and you were adding on to the skilled nursing workforce. So when you talk about from this perspective, I would like to give you another perspective where the healthcare organization, it's high time that you need to change your policies and procedures. You need to think about onboarding, training the nurses, new nurses. When you train the new nurses, you should also establish an open communication with the existing nurses. You should understand the pain points from their perspective. Along with that, we should think about technology integration so that we can save most of our time. And we have 5-6 Sigma lean concept where we actually implement in the medication preparation areas so that we can consume lots of our time and dedicate to patient care. Here, one more thing I would like to remind you, especially all the healthcare leaders, CEO, COO, CFO, because you always think about the expense. Just think about a different reality or a future where nurses are no longer considered as an operational expense. They are not an operational expense, but think about them as an investment. They are our investment for patient safety and exceptional outcome to provide a better patient care, and they are the one who is directly dealing with the patients. Yeah.
To add up to the strategy, I would like to say also, we all have to, as a leader, has to think and decide that what should be the nurse-patient ratios. You know, there are nurse-patient regulations are there, and we should stick to the nurse-patient ratios. It has been proved that a nurse cannot take more than 5 to 6 patients in general wards. But in ICUs or in BMQ special units, the nurse-patient ratio has to be strictly monitored. And as per the regulations, if a patient is on ventilator, it has to be 1:1 ratio. If you really want to give a proper patient care, and non-ventilated patient, it has to be 1:2. The moment we compromise into nurse-patient ratio, the moment we compromise into processes, that is how the errors take place and patient safety, patient care is at stake. So, Neeta. Okay. So, Neeta, now I would like to ask you a question. That is, what are the initiative strategies we would like to implement to reduce the burnouts and promote wellness in nurses?
Great. So I'll just give the audience a bit of stats. A survey that was conducted in 2022 had, they'd surveyed over 2,500 nurses, and over 75% of them indicated that they had burnout. In addition to that, they had asked what they would rate their general mental health and well-being as, with 1 being the lowest and 10 being the highest. And they rated their, I guess the average score was 5.8. And whereas previously, before COVID, it was about 8. So that shows that there's been a huge decline. And I think, once again, we need to go to the underlying factors. Nurses have probably one of the most challenging jobs in healthcare. They're faced with constant suffering. They're not only are patients suffering, but they're having to care for these individuals, and there's a lack of control. They can't control the outcomes of the patients. All they can do is really provide the care. And what ends up happening is, due to that lack of control, they end up dealing with aggression, not only from patients, but from one another. They end up, there's a whole bunch of literature that shows that nurses engage in horizontal violence, which is essentially bullying, and I would attribute that to a lack of control that nurses have. So one of the strategies that I've actually have started to implement is I've created an app. It's free for nurses globally, and it's going to be launched on April 1st. It's called NEW, which is Nurses Elevating Worldwide. And the intention of this app is, me being a nurse, I'm taking a pledge to empower other nurses. And what this app is going to do is it's going to enable nurses to connect globally and empower each other. There's going to be there's going to be a self-care resource kit, which is going to be accessible for nurses, and they're going to be able to use these self-care strategies on their breaks so that they can refill their inner resources on their shift, and they can go back out and really be the best version of themselves, because I think that's what's really lacking right now. Nurses are constantly caring for others, they're not caring for themselves, and they're not caring for one another. And so for me, it's really important that we're empowering one another to take care of ourselves and to take care of each other.
Yeah, I would like to add on that one of the key factors of accreditation for the organization is the support system. They will evaluate the support system of all the healthcare facility, how they promote their staff, empower staff, and how much they are considerate about the well-being of the staff. So we do have different activities that up to the staffs to promote their well-being, mental health. I think Madhumita have more to add on to this. Apart from that, what I would like to add on here is that it's very important that happy and healthy employees are more productive for an organization. When an accreditation surveyor or auditor comes to the hospital, the first thing they ask the staff is, are you really happy in your department? Why they ask this question? Because if they are happy means they are more productive, they will deliver the better care for the patients, and they have a good culture of safety in their department. They maintain a climate of positive environment where staffs are motivated to do more productive things. So apart from the well-being, one more thing which I want to mention here is try to implement a secondary victim program. because during the COVID times, especially during the sentinel events or patient death, the more psychological effect is being impacted on the people who are giving care, especially physicians, surgeons, nurses, who are directly involved with the patient. They have the psychological problem or emotional intelligence should be there to support them. We should counsel them, we have to investigate, and we have to make sure that we are not discussing about people. We are discussing about the problem and resolving it with correct action plan, not a punitive response to errors. Yeah, over to you, Madhumita.
Thank you, Shruti. In relation to burnout, like the things what we practice in our hospital, I can see, is that we encourage the nurses. I have empowered my nurses. We have empowered the nurses to speak out. You know, if you see anything wrong, please speak out. That is one thing. Then we have an open door system. Any nurse, whether it's a junior most nurse or a senior nurse, can walk into my office at any part of the day during the working hours and come out with their problems and can share their problems, and we look into it and we try to solve it. That is one thing. Then appreciating nurses for their good work. You know, yesterday somebody was mentioning about gratitude. We don't acknowledge the hard work of the nurses. We should acknowledge the hard work of the nurses. We should appreciate for the good work what they are doing. Human being, errors will happen. But when a nurse is doing a good job, nobody is there to appreciate. So I would request everyone that please appreciate your nurses for whatever little work they are doing. They are trying to put their best. Little bit of appreciation will encourage them and they will do their best. Then celebrate birthdays. You know, in their departments, in their units, they can celebrate their birthdays. You can organize a one-day picnic for the nurses. All nurses cannot go together. But yes, majority of the nurses can go. So that is how you help them to express out their feelings, help them, and that is how you will be able to reduce their burnouts. Then another one thing is celebrating festivals. We do celebrate, you know, India is very rich in culture and festivals. So we try to celebrate all the festivals, whether it is Christmas, whether it is Diwali, whether it is Onam, whatever it is. We celebrate, and it is the nurses who participate, and that is how, you know, we encourage the nurses to have some social gatherings. Then one more thing we do is, being in the organization, we conduct exclusively nursing conference for our nurses. It is a 2 days exclusive nursing conference where the nurses are participating in the conference. They are the speakers, and it is globally nurses participate in our conference. So there are various methods. It is only as a leader, if you want, you can implement. That is what I would like to say.
Great. All right, so moving on to our last question, Shruti, could you please tell me what are some strategies that an organization can adopt to enhance patient safety in nursing?
That's a good question. So to enhance patient safety in nursing, we talked about lots of things right now here. Apart from that, we need to think about technology. Since we have lots of sessions here, discussions related to real-time data collection, healthcare management system, health information management system, data intelligence plays a key role here. There are lots of key performance indicators right now, which international benchmark, where we can really monitor the performance of the nurses. So there is one question that we usually ask the nurses. The thing is that, are you performing well in your department? Of course, you will say positively, yes. So how do you measure that? Because if you need to improve, you need to measure. You need to show the statistical evidence. So when we talk about the problems, let's start collecting the data. Let's turn into a real-time source where we can escalate this to the management. So when we have the data, we can identify the opportunities of improvements. So we do have quality improvement projects where we use different types of tools, Focus PDCA, Lean Six Sigma technology. during this, what is the benefit is that we can really see what is really happening in the department because process owners are there participating in the quality improvement project. So when we talk to the process owners, they are the one who really face the problems. So we can collect the data, we can analyze it, and we won't stop it once we achieve the target. We have to continuously monitor it. This is what I have to add on. One last thing here I want to mention is about safety huddles. This is a good practice which we implemented in our hospital, and it was really successful. Initially, when we bring this concept, everybody was like, in the early morning, you have to go up, you have to stand and talk. So they were like, why we are wasting our time? Why need to waste our time? But later on, we identified that 5 or 10 minutes chat between the leaders or the managers or the staff involved in the process have changed a lot. We really escalated lots of patient safety issues which the management didn't actually see. They saw it in the patient safety huddles, and we could do quick decisions. So safety huddles, try to implement in all the healthcare organizations. You will feel the difference, and you will feel that people are empowered, involved, and they are the key decision makers here.
Yeah, I agree with Shruti. The same thing is with our hospitals also. In India, we have various accreditations for the hospitals. And one of the accreditation is your nursing excellence. If a hospital is having nursing excellence accreditation, then it is said that in this hospital, there are standardized procedures and all the processes are followed as per the standards laid. So quality indicators has to be monitored if you want to literally review the patient care and patient feedback. And the quality, it is not that there should not be any punitive action for any incidences happening, because the moment you have a punitive action, then no incidences will be reported. So it should be a free culture, free reporting system, where no punitive actions are there. One, we as a leaders have to look into the root cause analysis. We have to see where the processes have gone wrong and how to rectify those processes and implement the correct process. And simultaneously, you should involve the nurses into policy making, because nurses are at the bedside. They know what is good and what is wrong. So in policy making decisions, the nurses' involvement is very much required, and the management should, in our hospital, the management is very proactive, and they ensure that the nursing department is there in all the committees and in all policy making procedures. So that is one culture the organization should try to develop. And simultaneously, the organization should encourage education, ongoing education and training program, because it is very difficult to get skilled nurses. Mostly you will have freshers who are coming into the hospital. So if you do not have proper education system, proper training system, then you will not be able to train the nurses.
Thank you. Yeah. So just kind of building off a couple of points that you had both stated. So Shruti, starting off with you, you said that healthcare needs to be more proactive in integrating technology. However, I think one of the biggest issues is, and one of the panels earlier had mentioned this, we are behind in implementing technology in healthcare. And one of the reasons for that is, once again, I'm going to go to projection bias. The leaders that we have in healthcare are individuals who actually did not grow up in technology. So there's a lot of hesitancy to bring technology forward. For example, there's AI, and we could be using AI in a proactive, safe manner to reduce workload for nurses. However, there's hesitancy because it's something that's unknown, and of course people do not like venturing down things that are unknown. However, it's important that we're being proactive and we're jumping on these issues. So I think in order for us to be able to integrate technology effectively into healthcare, leadership needs to really change their perspectives and also develop the competencies needed to lead the change. The second thing I'd like to discuss, which you were mentioning, Madhumita, is regarding involving nurses in policy making. Now, I didn't mention this, but I'm also a director for a hospital, and I have invited nurses to committees, and what I noticed was it's ineffective, because nurses will attend, but they do not speak up, because once again, as I mentioned before, they haven't been empowered. That hasn't been the culture. So they'll attend and they'll agree, basically like robots. So a strategy that I've actually started to implement is I've created decentralized working groups where I'm providing nurses with the best current evidence-based practice. I'm providing them with the accreditation standards. I'm providing them with the problem, and I'm saying, you find the solution. And so they're actually working based off of all of the information. They're finding the solutions because they know what the issues are, and they're responsible for rolling out the implementation of their solution and evaluating to see the effectiveness of it. I think that's how we're really going to be able to empower nurses, is by giving them their power back and utilizing their strengths. And I guess that brings us to a wrap for our discussion. I guess we have about 5 minutes, so I'd like to open it up to the audience to see if there's any questions.
Just a quick question. So I think you've spoken about the whole aspect of both the physical and emotional well-being of nurses within a hospital ecosystem. But as you're seeing, there's a significant emergence of home health care. And especially in a construct, and I think for last 6 years, 7 years, I've been working in that field, primarily trying to see how we can bring in both advanced nursing into home health for setting up a home ICU kind of a situation. Now, how do you extend, or what practice do you believe technology can play and processes can play to bring in more safety to a work environment of the nature? That's my question.
So to answer your question, if you have to have a home healthcare system where an extended ICU can be there, again the question comes to a skilled nurse, right? The nurse has to be properly trained, and we have to look into the credential of the nurse and how skillful the nurse is. If the nurse is not skilled, then the adequate training can be given in a hospital scenario, and then the nurse can be deployed in a home setup, in a home scenario where she can give patient care. So everything is related to skill and competency, and obviously the exposure that a nurse gets in a hospital is to be considered.
That's a quick question.
Yeah, adding on to the processes that you were talking about, I think the question is not completed. Can I complete?
Yeah, you can complete.
Yeah, because he was asking a second part about the processes that we can implement for home care services. Of course, there are standards related to home care services, especially Joint Commission International Accreditation Standards have about 65 criteria that talks about home care services, how we can monitor, how we can see that our staff goes there, document, and we can ensure the psychological safety of the staff who goes there, because we are not there, we are not directly involved there. We don't know how the patient reacts. The patient may be aggressive. We don't know what the situation and how they will support the staff. So there are certain standards that we can follow, and we have policies and procedures in place to make sure that staff goes there, staff safety is concerned. Apart from that, they deliver high quality of care and safe care delivery is done. Is that fine? Understood?
Just a quick question. That was a very thought-provoking session. Thank you. So in the UK, we have ample opportunity for nursing, let's say senior nurses to become director of nursing. And when I discuss with the director of nursing, their perspective becomes lay drift away. So you are right, absolutely. If you work with the nurses, especially in emergency department, you can feel that, the burnout. But my question to you is that, because you mentioned that when you invite them, they don't speak up, which is true. Yeah. So why don't we develop a leadership among them, and then we have some seasoned nursing leadership to make a policy? And why do they change when they reach a good position and they just become suddenly, we start working in silos then? That's the question.
Yeah, so that's a great point. And I mean, I was talking to Madhumita about this earlier. I think the way it's traditionally happened in nursing, and I'd actually say in healthcare, is you're a good nurse, so you'll make a good manager, you'll make a good leader. But the skill set and competencies needed to be a leader or a manager is completely different than being a nurse or a doctor or any other healthcare worker. And so I think what we need to do is we need to start investing in nurses, doctors, any healthcare professional. If we want them to be leaders, we need to start teaching them leadership competencies. And actually, sometimes it's counterintuitive because people, like, to be a direct care provider, you need to be very empathetic, and so some people don't like conflict management or conflict resolution. And so some people actually may not, even though they're good nurses, they may not make good managers just because that's just not part of their personality where they want to be able to actively be dealing with conflict. So I think part of the issue is individuals aren't actually given the opportunity to develop the competencies. They're just kind of thrown into these positions. And then when they're thrown into the position, the culture is already that you have to be a certain way. So in order to maintain status quo or to maintain their status in that position, they conform rather than really authentically embracing who they are and being able to build up on their competencies.
To add to your question, sir, it is like empowering the nurse. You said once a person reaches to a leadership place, then she forgets everything. So it's not, it is the question of empowering. You empower the leader, you empower her. So you will see the changes that she tries to bring out in the junior. You have to involve her into the decision makings. So when you involve into the decision makings, then she will try to change. She will try to bring, the changes what we are expecting to reduce the burnouts and all. So it is, again, a question comes, again to the end, is invest in nursing, acknowledging nursing, investing in nursing, that is required. Otherwise, a time will come when there will be acute shortage of nurses, and the hospitals, God forbid, the hospitals will run without nurses. So it is, until unless we invest on nurses, we empower them, we allow them to participate in policy makings, we allow them to have decision makings, things will not improve.
Adding on to this, there is a tool from HRQ, Patient Safety Culture Survey Tool. Anybody have been using this? This is a really good tool. Try to implement it in your hospital because there are nurses who are very shy. Even if you empower them, you encourage them, they don't want to come and speak up in the limelight. So we use this tool to get the perspective of the nurses, and we use the challenges turn into opportunities.
All right, our time is up. Thank you so much, everyone. Really appreciate the questions, and it was a very engaging audience, so thank you.
Thank you so much.
Wonderful. Ladies, that was amazing. Please take a step forward on the stage so we can get a lovely group picture.